Good afternoon and welcome to Downing Street for today's coronavirus briefing. I'm joined to my left by Dr. Nikki Kanani, Director for Primary Care at NHS England, and on my right, Dr. Mary Ramsey, Head of Immunisation to Public Health England. Today, I'd like to bring you the latest on our vaccination programme and our work to get even more people protected from this deadly disease. We've come a long way since we gave the world's first clinically authorised vaccine just over 6 months ago. Since that very special day, we've now given a first dose to 82% of all adults in the United Kingdom. And today, I can confirm we've reached the milestone of 3 in 5 of all adults getting the protection of a second dose. Because we've been able to move at such a pace, any adult in the UK can now book their first dose. In the 2 days after we opened our booking system to anyone over the age of 18, there were 6 appointments being booked every second. And I've been absolutely thrilled to see videos of young people coming forward at some of our major vaccination events last weekend, and I'm sure they'll be doing the same this coming weekend. The enthusiasm is making a huge difference. We've already given first doses to almost half of all 25 to 29-year-olds in England. And only a week after the programme opened to all adults on Friday, one third of people aged between 18 and 24 have had their first dose. To all of the young people who have stepped up, I want to say a huge thank you. You've protected yourself, you've protected your families, and you've protected your communities. Because the one thing we know, is the vaccines are making the real difference. The vaccines are our way out of this pandemic. The latest data show that the vaccination programme has already saved over 14,000 lives, and I can share with you that now it has prevented over 44,500 hospitalisations in England alone. That's 2,500 hospitalisations prevented in the past 2 weeks. And when you look into the makeup of hospital admissions, you can clearly see our vaccination programme is working. Can I have the first slide, please? In January, people over 65 made up the vast majority of hospital admissions. That is why we vaccinated them early in the programme. If you look at the most recent data, they show that now they make up less than a third. So when we look at the protection that the vaccines deliver, it is clear from that slide that it's extremely effective, especially with 2 doses, against the Delta variant. The recently published data from Public Health England looked at around 500 hospital admissions with the Delta variant. Of these admissions, 324 patients, so over 60%, were unvaccinated. 87 had received only 1 dose of a vaccine, and 40 had received 2 doses. So fewer than 1 in 10 people in hospital with the Delta variant had received 2 doses. This really does show the importance of getting the jab and critically getting that second dose. So our mission is now to get as many people protected as we can and to protect them as quickly as we can. Last week, we took the difficult but I think essential decision to pause step 4 in our roadmap for 4 weeks, with a review of the data after 2 weeks, and we will absolutely have that review and share the data with the nation. We're going to use these 4 weeks to give our NHS that bit more time so that we can get those remaining jabs in arms of those who really do need them. So let me give you an example of why it is so important. 2 weeks ago, there were over 2 million people over the age of 50 in England who'd had a first dose but not their second dose. Now, that number, 2 weeks later, is 900,000, down from 2 million to 900,000. This pause has saved thousands of lives and will continue to do so by allowing us to get more of the second doses into arms of those most vulnerable to COVID before the restrictions are eased further. We've also reduced the interval from first to second jab for over 40s to 8 weeks. And I would urge everyone watching, if you are over 40, come forward and have your second jab. Take the opportunity and get the second jab early. You can do that by going online at the National Booking Service or calling 119. We've seen phenomenal uptake and enthusiasm for our vaccination programme so far. The United Kingdom has one of the highest rates of vaccine confidence in the world. 9 in 10 people, 9 in 10 of all adults say they've either taken the vaccine or that they want to take the vaccine. It's something we can all be proud of, but it is no accident, ladies and gentlemen. We got here because we have actively, and Nikki will be very much explaining exactly how we've done that, gone out to really address people's genuine concerns and have open two-way conversations about these vaccines and how safe they are and how important they are to saving lives. And because we've worked with local communities on the design of the vaccination programme so we can deliver it in a way that works for people, in a place they trust, by people they trust, our vaccination programme has been delivered in the community, by the community and for the community. And it's been a brilliant, brilliant experience to see vaccinations being given in churches, synagogues, gurdwaras, mosques, temples and many other pillars of the community all across the whole of the United Kingdom. And to see the determined effort of the brilliant people, real partners on the ground, to reach communities where take-up has been lower. This concerted community-led effort, I believe, has truly paid off, and we're seeing real positive results. So if you look at the latest data from the Office for National Statistics, the ONS, vaccine hesitancy has halved in the past few months among black and black British people since February. And it's halved among Asian and Asian British people too in the same period. This is real progress, but we know there's much more to do. As we look to tackle and take on those final steps, those hard yards on the road to recovery, we need to make sure as many people are protected as possible. So we're intensifying, doubling down our efforts to get more people to come forward. And we're seeing real results in places like Bolton and, of course, in the Northwest and elsewhere. We're honing in on areas where uptake is lower. For example, in London, where the percentage of first doses is slightly behind the other areas in the United Kingdom. The London team is doing an incredible job. And I can confirm today that we're supporting them. We're supporting them with a London summit that will take place on Friday, bringing together senior officials, the NHS in London, the Mayor of London, clinical experts and community leaders from across the capital, so that we can see what has worked and how we can learn from it and scale it, and of course focus on how we make sure we really do boost that crucial uptake in the crucial few weeks before the 19th of July. Thanks to our vaccination programme, our incredible NHS, this country is getting a little bit safer every day. Whatever your age, whatever your background, the vaccine will protect you, it'll protect your family, and all the people that you care about. So please come forward and get both doses so we can take that final step on the road to recovery. Thank you. Now I'm going to hand over to Dr. Mary Ramsey to just take us through the latest data, and then we'll hear from Nikki Kanani. Mary.
Thank you. I just want to start, obviously, by reaffirming what Minister has said, that the scale and pace of the programme has been very impressive, and I too want to add my thanks to the NHS for delivering that. And I also want to thank my colleagues in public health across the country who, as part of that public health system, have supported the NHS in reaching out to those communities so that we can achieve the very high and impressive levels of coverage that we have. I do also want to thank my colleagues in Public Health England who have, with other scientists across the country, been analysing the data on the Delta variant so that we can really inform ourselves how best to take forward the roadmap. And our own data now shows very clearly that the vaccine protects against the Delta variant, particularly against hospitalisations and serious complications, with over 90% protection from 2 doses of either vaccine. So the message is clear that people need to come forward and get their second dose, and their first dose, obviously, but their second dose too. It's very important to complete the course. I would also like to use this opportunity to just remind people that there are other effective life-saving vaccines available on the NHS. And during lockdown and during the pandemic, there has been some drop-off in the uptake of some of those vaccines. So this is an opportunity, I think, as we come out of this pandemic, for people to think again about the vaccines that they might have missed out and come forward. In particular, people leaving school need to make sure they've had their meningitis jab before they go either to university or start work this summer. People in their 70s may have missed out on their shingles vaccine, so they should be starting to come forward this winter. And we know that some babies are behind on their 6-in-1 and MMR vaccine, which is really very important for them to catch up to. The school immunisation programmes in particular have struggled because schools have been closed so much. And so our school immunisation teams are doing a brilliant job in trying to reschedule appointments so that people can get some of those life-saving vaccines like the HPV vaccine, which protects against cervical cancer. So I strongly encourage people who've missed out for whatever reason to make sure they get an appointment and come forward. And obviously, looking ahead to winter, we will be launching our flu programme in not so far away now. And obviously, if you are offered the flu vaccine, I would encourage you to come forward to avoid the potential double danger of having flu and COVID. I'm now going to take you through some of the latest data, if that's okay. Could I have the first slide, please? So this figure, I'm sure, will be familiar to people. It shows the number of cases of COVID confirmed positive tests each day across the UK. And you can see that the numbers have been increasing since early June, in line with the increased transmission of the Delta variant. However, the numbers are much lower than they were during the second wave in early this year. And we're running at around about 10 to 11,000 cases per day at the moment. There's a very high figure today, which I think is largely contributed by some surge testing that's been going on in Scotland. So sometimes these figures do go up for good reasons, as well as other issues. But I think the next graph, the next slide, if we can go on, shows you what's happening to hospitalisations. And you can see that the number of hospitalisations is rising, but at a very much slower rate than we're seeing of the cases. So I think this is showing us the evidence that the vaccine is working and it's breaking the link between cases of infection and hospitalisations. And if we move on to the third graph, which is showing you the numbers of deaths, well, although every death is a terrible tragedy, the numbers are so small on this graph that you can't even see any increase. So again, suggesting that the vaccination programme is really helping to prevent the severe illnesses and the hospitalisations and the deaths from COVID. And the final slide is perhaps the most positive one, which is just showing you the rate of increase in the number of people receiving vaccine. So we're now up to 43.4 million people who've received a first dose. And of these, 31.7 million adults have received a second dose as well. And you can see the rate of increase in the second dose is catching up on those first dose, just as we have recommended. So I think that's really a very a positive note to end on. So I'll hand back to you.
Thank you very much, Mary. And it's all about getting that second dose. Nikki.
Thank you. And that last slide is so heartwarming, actually. Remember that it was only last week, thanks to the incredible efforts of not just our NHS staff, but our local authority staff, our public health teams, but also incredible tech and data teams and supply teams who, behind the scenes, have meant that our NHS COVID vaccination programme has been the most successful vaccination programme, the biggest vaccination drive in health history. It was only last week that we opened to every adult in England. And what that meant is that anybody, wherever they live, whoever they are, if they are over the age of 18, they are eligible for a vaccine. And you can now book to have your life-saving vaccine either online or you can wait to be contacted, but please don't miss this incredible opportunity. We've now delivered more than 63 million vaccinations since the first person in the world was vaccinated by the NHS, Maggie Keenan. And some of you will remember that really historic day. Well, now we are only 200 days on and we have already protected more than 4 in 5 adults with their first dose and over 9 in 10 people aged 50 or over who are now fully vaccinated, having had their first and their second dose. And the NHS COVID vaccination programme continues in full swing. As the Minister said, 1 in 3 people aged 18 to 24 have already had their first dose. Thank you. You are doing an incredible job protecting your community and your family. And whilst this remains overwhelmingly positive, we must remember that we're not quite tackling all of the hesitancy that we see. We know that some people are still anxious about coming forward for their vaccine. But tackling vaccine hesitancy, building vaccine confidence has been at the heart of our programme since the very beginning, and it's something that I'm personally very passionate about. And I'm pleased to say that we have made more progress since I last joined you. We continue to close the gap with more people from ethnic minority backgrounds coming forward, and uptake is increasing faster in Black African and Pakistani communities than in white backgrounds now. Between mid-March and mid-June, uptake in Black and Asian communities has continued to rise, increasing from 75% to 86% in Asian communities and jumping from 55% to 68% in Black communities. Since the NHS launched its action plan to tackle vaccine hesitancy and encourage uptake, we've seen incredible examples around the country of people who have gone over and above to make sure that their communities are protected. Sharon in London with the Vaccine Taxi programme, really getting into the heart of communities late at night and over weekends. Tim in Basingstoke, who's gone out to his homeless population, not just to offer the vaccination for COVID, but also for flu, and to deliver some life-saving health checks as well. And Charles, who we've worked with closely at the CAHN, the Caribbean African Healthcare Network, to deliver a Black African and Black Caribbean toolkit so that we can really make sure that the vaccine is something that everybody wants to take up in their own community. There's still more to do, but our message from the NHS is clear. It is never too late to come forward and take up your vaccine. Your vaccine has a name on it, it is for you, and it is an evergreen offer. So as soon as you feel able, come forward and we will vaccinate you. It will give you an important peace of mind and protection. And over this weekend, all of our staff and volunteers will be gearing up for a weekend of walk-ins, making sure that in every part of the country, it is easier than ever before to get your vaccination. And on the advice of the JCVI, the NHS is proactively contacting everyone who are 40 and over to bring forward their second dose to 8 weeks. Please make sure that when you get that call, you take up that second dose at 8 weeks, because we want to protect you as quickly and as safely as possible. As I said, more than 4 in 5 are now fully vaccinated, giving people the maximum possible protection from coronavirus. But if you're contacted to do so, please bring forward your appointment and get that protection as soon as possible. Getting vaccinated is the most important thing that you can do for you and your family and your community. So if you haven't done so already, please make today count and book that life-saving appointment for yourself. Thank you.
Thank you, Nikki. We'll go to questions from the public. Anna Rutland.
Statistically, current figures published state that most people going into hospital now are unvaccinated. But is this a population that chose not to take up the offer of a vaccine, or are they of an age where they haven't been able to receive a vaccine yet? And will these people hold back the freedoms of others already vaccinated?
Thank you, Anna. I had some of the statistics in my opening remarks, and you're quite right. If you look at the Delta variant, which is why it's so important that we vaccinate people with those 2 doses, because that's the real protection against the Delta variant. Almost 60%, over 60% of hospitalizations from Delta are people who are unvaccinated, but they're still coming forward. Now, the difference this time, because of the vaccines, so in January we were seeing 70% of hospital admissions being people over the age of 65, and then 30% under. That number has flipped the other way, and so it is a combination of people who still, nevertheless, so there's still 30% who are over 65 that need that double protection, and they're still coming forward. When I went through the data with the operational team this week, in the last few days, we're still getting 70,000 people coming forward who were eligible, hence why Nikki's point about the offer being evergreen, and they just hadn't come forward. The walk-ins, the ability to make it much easier for people to, whether it's a mobile vaccination sites or the vaccine taxis or the buses, those people need that protection, and we keep going at pace to make sure that we protect the whole country, because the virus, Anna, will attempt to survive. The way it survives is by finding people that are unprotected and then infecting them, especially communities that may be close-knit. So if I give you an example, if we get to 85% of all adults double vaccinated, and that's a really a good place to be, and the vaccines are 85% effective against infection, they're much more effective against hospitalization and death, and that's a really good thing. But against infection, 85 by 85, that's still 72%. So there's still 28% of the population, the adult population, that the virus can go after. Hence why we've got to keep going at pace to vaccinate as many adults as we can to make sure that by the 19th, and I'm confident of this, that we will have 66% of the adult population with the protection of 2 jabs by that date that the Prime Minister has set us. Nikki, I don't know whether you want to add anything in terms of...
I think it's just worth remembering back to the first days of the pandemic and lockdown, and what we saw come out so strongly was a sense of community and society where we all looked after each other. So as we go through the vaccination programme, there will be people that are hesitant, but they are just as much a part of our society. So let's help each other to build that confidence, because actually none of us are safe until we're all safe.
You're absolutely right. Absolutely right. We'll go to Andrew Chichester.
Why are COVID vaccination centres closing when so many people still need to be vaccinated?
Thank you, Andrew. So, Andrew, we built a deployment infrastructure, vaccination infrastructure. If you remember, Brigadier Phil Prosser stood next to the PM on this stage and talked about us standing up a national supermarket chain in about a month, way back in November of last year, to vaccinate, and then growing it 20% every week. So the deployment infrastructure can actually deliver many more vaccines than we can. Our record, I think, was 27 jabs a second. So sometimes, because of obviously vaccine supply, what you can't do is wait and then build your infrastructure. So we built the infrastructure deliberately, and then the local systems will decide whether the primary care networks who've done the real heavy lifting, and I thank them for that, the GPs have done an incredible job, or the community pharmacies, over 500 now vaccinating, or the national vaccination sites, how we deploy and how we deliver that, and obviously taking into account this big final push of, having walk-ins, having mobile centres. All that deployment means that sometimes we will move vaccines around the system so that you use your inventory to where you need it to go instead of being in fridges to get it in people's arms. So sometimes that may mean that some vaccination centres are stood down in favour of a mobile site or a walk-in centre or elsewhere. Nikki, you've been absolutely central to the primary care effort on this. Of course, yourself vaccinating.
I've had the pleasure of vaccinating. My general practice teams and pharmacy teams have done an incredible job, just keeping going. And I think just to add to what the Minister's described, often it's not that centres are closing, it's that staff are busy vaccinating in other centres, or indeed are members of a clinical team doing other parts of their day job. And it's a good reminder the NHS workforce has kept delivering on this vaccination programme. We've delivered every target that has been set us, but also we need to look after our workforce as well. So if you're out and about at vaccination centres getting your vaccine, please remember to thank the staff that are there. They are doing a phenomenal job.
Thank you very much, Andrew. We'll go to the press. Adina Campbell from the BBC.
Thank you, Secretary of State. First of all, if I could ask you about vaccine take-up rates within our ethnic minority population. Latest data shows you're less likely to have had a vaccine if you're black, and take-up rates within those communities are much lower. Now, despite a number of government, public health and social media campaigns, it's clear there is still some reluctance out there. Is it time to take a new approach? And if I may ask a follow-up question about the changing Delta variant, the most commonly reported symptoms being headaches, runny nose, a sore throat. Should the government websites be updated to reflect these updated symptoms?
Thank you, Adina. And you ask a really important question around, how do we make sure that Black and Black Afro-Caribbean communities have that confidence in the vaccination programme? And I looked at the data before coming on today. If you look at the uptake amongst phase one, and that's where you're absolutely right to say, if you look at the data and you index on ethnicity and, of course, income, then Black and Afro-Caribbean communities have effectively trailed behind, say, the white community. Since the 1st of April to date, the additional uptake in the white communities is about 3%. Now, that's starting from a very high level, and therefore that 3% is good going. But actually in Black and Black Afro-Caribbean, it grew by 7%, and amongst the Pakistani and Bangladeshi community grew by 10%. So that's some of the stats that Nikki was referring to is because of our uptake strategy that I launched on the 13th of February, which is all about making sure that we share data with Directors of Public Health locally. We make sure that we give them the resources to be able to have community champions. £23 million went into that to give them the GPs the ability, because we made the contracts more flexible to be able to hold pop-ups and some of the other sites extending hours for people to come forward, having vaccines in places that people are familiar with and they trust. And all of that is working, and there's more to do. This past week, we launched the toolkit, a really short, sharp, very concise toolkit of how to make sure we take the best learnings of how people have reached out to Black and Black Afro-Caribbean communities and got people that confidence to come forward and get vaccinated, and how we can scale that to other areas. So that's all ongoing, and I'm confident that we'll continue to meet that. On the Delta variant, I think it's important that we make sure we always update our information and Nikki will say something around this in terms of what the symptoms may be. The most important thing to remember is please come forward and get your second jab if you are over 40. Make that appointment in 8 weeks, not 12 weeks. And then, of course, those who now are eligible for their first dose, anyone over the age of 18, to come forward and get your first dose as well, because that also offers you quite high levels of protection, not against the infection as much as double dose, but certainly against serious illness and hospitalisation with the one dose. Nikki.
Thank you. I mean, all I'd add about uptake is that every conversation counts. We have to keep going. We owe it to local communities to spend that time to make sure we build confidence. And every time I'm in surgery, I have a conversation where somebody tips from saying no to maybe or maybe to yes. And that's what makes a difference. And sometimes we see huge increases week on week, and sometimes they're smaller. But every single vaccine we give is another person protected. And there was a lovely story at the weekend where somebody who was in her early 20s brought her grandma in who hadn't been vaccinated because she had the confidence, and she brought along that confidence. And her grandma was then able to be protected from an ethnic minority background. And I think we'll see more of that as well as younger people take up that really key responsibility that I know they feel, that they want to make sure that their communities are protected. I'm sure Mary will want to speak a bit more about the Delta variant and the symptoms though.
Yes, so I mean, I've seen the data you talk about that suggests that there may be a slightly different symptom rate with Delta. I'm not that convinced personally myself yet. I think one of the problems with these very common symptoms is they're quite difficult to convincingly link to the infection. But I think the key message is that people are being tested without symptoms, and that's because we know that this infection causes asymptomatic disease quite commonly, and a lot of our testing now is being done in asymptomatic people using lateral flow devices, etc. So I don't think there's any evidence that we're missing cases, more with this variant than we are with the other variants that preceded it. So I mean, the main message is really about obviously keeping the hands, face, space, the air, and if you do have symptoms and you're in any doubt, then come forward and get tested. But you can get tested in the absence of symptoms as well. So obviously that's all important as part of our drive to make sure we can kind of stop people spreading the infection. But the single most important thing, of course, is the vaccination programme.
Emily Morgan, ITV.
Thank you very much. You've been trying to persuade people from certain communities to be vaccinated for months now, and there will always be some people who simply won't get the vaccine. At what point will you accept that, and how do you propose to protect them?
Thank you, Emily. I think we have to strain every sinew to make sure we reach every community, because all the evidence that I've seen is that it's about access to the vaccine. Whether it be in Haringey, where they had teams going out, actually talking to people, explaining when the mobile vaccination unit will be in their area, or helping them to book that appointment. It's about sharing data with the local systems, with local government, with directors of public health. And then it's about those conversations that Nikki spoke to. I'll never forget when Nikki was, right at the beginning of this programme, was vaccinating in one of our residential care homes for the elderly. And she spent the whole day there, obviously doing the residents and then the workforce. There was one lady who just refused to have the vaccine from, I think, the Black and Afro-Caribbean community. But it took Nikki about 5 hours, she told me, of just really allowing the lady to ask the questions and have those questions addressed. And in the end, before she left, she tapped her on the shoulder and said, you know what, I will take that vaccine. So I think we've got to keep going. It's incumbent on all of us to keep doing this. But I think in many ways, it will be that double vaccination and that protection. And of course, our ability to test at scale and search test and genome sequence. I think the two things will go hand in hand. In the sense that we offer that protection of the vaccines because we know vaccines work, but also to control the spread of the virus, because we're going to have to live with the virus, and we will transition it as we're beginning to do now from pandemic to endemic. We've got to also make sure we help the rest of the world as well. So I don't think I will ever stop doing it, Emily. I don't know if Mary wants to add anything else in terms of.
Well, all I can say, I mean, this isn't new. I mean, this is something we struggle with for all of our vaccine programs, and we have to just keep going, and we keep the offer open, as Nikki said. And, you know, when we begin to get to the state where the disease is just in very small pockets of the community, then sometimes that outbreak or those cases are another opportunity to go back. So I don't think, as you said, I don't think we ever stop trying to persuade people to come forward and have the vaccination.
Helia Brahimi, Channel 4.
Minister, how worried are you about the new Delta Plus variant, and does it risk derailing reopening next month? And you said that vaccines are a way out of the crisis. Surely now we should introduce vaccine passports. It would help the travel sector, with a huge boost, and surely it would help get even more people to come and take the vaccine.
Thank you, Helia. In terms of how the virus behaves and mutations, the virus will continue to mutate. That's what viruses do. They try to survive by infecting people and then mutating to try and evade a vaccine. Now, the good news is that the vaccines that we're deploying, both the Pfizer-BioNTech and the Oxford-AstraZeneca and Moderna vaccines, are incredibly effective against the Delta variant after 2 doses in terms of transmission, but also on hospitalization and, of course, serious infections. So that's the good news. The other bit of good news is we have probably one of the largest genome sequencing infrastructures in the world. The reason this country picks up these variants early, whether it was the 117 early on or the B1617.2, the Delta variant, or other variants, because viruses will continue to mutate. That capability is incredibly important to our future. And of course, then you talk about certification, vaccine certification. We know a number of countries will require some form of certificate, as they've done historically, whether it's yellow fever passport certification in the past or otherwise, which is why on, I think, 17th of May, we made the operationalizing of that possible with either the app or a letter that you can receive demonstrating that you've been vaccinated. And of course, we'll continue to work with other countries through the Travel Task Force to see how we can build on all this really good progress in the vaccination program, so that we can have the use of the double vaccination with testing, open up more of our economy. I was at Wembley for that first England match against Croatia, and it actually worked incredibly well. As part of the events trial of going for a lateral flow test beforehand, because I hadn't had enough time for my second vaccination, because one of the rules was you had to have either double vaccinated and have 14 days after, or a lateral flow test within 24 hours of the event. So a combination of, I think, is the way forward. And we're looking at all of that at the moment to see how we can, one, open up more of our economy, and of course make sure that we work with other countries to facilitate travel globally, because we need to get the travel industry back on its feet too. On the Delta variant, I know that obviously Mary and Public Health England do incredible work in keeping an eye on all the variants, and the moment they think a variant is under investigation, they come to us, and of course we work together to make sure the resources are there to be able to really test and then genome sequence, or when it moves to a variant of concern, the VOC, then we go even further with that. Mary, I don't know whether you want to add anything to that.
Not much to add. I mean, I think, as Minister said, we have the best system in the world probably for picking up these cases. We've only seen 41 of the particular variant with this additional mutation in this country, so that's very small. And we are obviously around those cases, we will do enhanced testing and enhanced follow-up. So I think we're on top of the situation. I think we continue to be vigilant. But the good message is that what we expected to happen with Delta was that the vaccines would prove to still work against the more serious disease, and we expect the same for this other variant. But there's also the option of having different vaccines in the future, and that's something we'll have to continue monitoring. So vigilance is our best sort of friend here against these mutations.
Thank you, Mary. We are future-proofing that optionality of vaccines for both the booster and, of course, for an annual vaccination programme as we transition this from pandemic to endemic. Asad Ali from UK 24.
Thank you very much. My question is you just talking about the Pakistani and Bangladeshi community. I'm in the community and I'm living in East London, where the most variant people from Pakistan. But the problem is that we blaming them not to have vaccination, but behind that, there is misleading information in the community. For example, they say loads of WhatsApp messages come in every day from the different numbers, and they say if you are vaccinated, you will die within two years. And also, the WhatsApp messages growing in the community. If you vaccinate, you're not able to give the birth to your next kid. So these kind of the misleading information stopping the community not to go for the vaccination. So my question is, what's the government taking steps to stop these messages and misleading information?
Azad, thank you very much. A really important question around some of this, what I think malign information or disinformation, I should say. And both those examples you gave are completely untrue, that the vaccines are incredibly safe. We have one of the best regulators, independent of government, that regulates vaccines, the MHRA. And of course, we have the yellow card system that, again, reports any adverse incidents. And that is all published by the MHRA. And of course, Public Health England does an incredible job. We have the pharmacovigilance that we have in the UK. And of course, we share that with other countries in the world, like the US, like Europe and elsewhere, is incredibly important. But that sort of disinformation is incredibly harmful, both to communities in our country, but also globally. I just want to say a couple of things on those. One, we have a unit that we stood up actually back in March, April of last year at the Cabinet Office that looks at disinformation, works with the social networks to highlight it to them and take it down as quickly as possible. The really important thing is to share the real information, to share the accurate information, to go to your GP or your local health centre, or to log on to NHS websites and get that, or Public Health England websites, or of course the MHRA websites, and get all those questions answered. That's the really important thing. The other thing we're doing as part of our presidency of the G7 is we've taken on a global campaign working with a number of global partners and academic institutions to get that positive information about vaccines to the rest of the world, because this is an equally challenging problem of misinformation in vaccinating the whole world. And as I've always said, no one's safe until we are all safe. Nikki, I don't know whether you want to add anything in terms of practitioners on the front line, yes, from those communities, from Bangladeshi, from Pakistani communities, actually coming forward, being vaccinated and explaining to the community how safe the vaccines are.
Yes, absolutely. So we've seen incredible levels of uptake, Mr. Ali, because the local community has decided that they want to get themselves protected. We've had a fantastic response from the Bangladeshi community through local restaurant chains who have said, you know, let's make this a really positive and easy to access vaccine. So we will keep working with local communities through people like yourselves to really help show that this vaccine is safe, and not only safe, it's life-saving. Social media teams have been incredible up and down the country, and we still need the help of social media giants to get rid of that disinformation. And I think it is incredibly unfair that anti-vaxxers and others try and promote this awful information, because it is risking your life, the life of your community, and the safety of our sites as well. So I utterly condemn that, but really keen to work with communities to find different ways to make sure that they feel confident to take up their vaccine.
Thank you very much. And our final question is Barney Chowdhury of Eastern Eye. Barney.
Minister, thank you for being so honest in saying that you still have pockets of vaccine hesitancy. And my calculations from Nikki's figures suggest that 1 in 6 Pakistani and Bangladeshi people still haven't been vaccinated or haven't got their second jab. So why is the government failing to reach these communities 6 months after the start of the programme? And Nikki, you said that you're going into mosques and restaurants, but what else specifically are you doing to try to reach those hard to reach communities, those vaccine deniers, to actually get a second jab?
Thank you very much, Barney. So one of the things that we've done, and Eleanor Kelly, who heads up the deployment campaigns, local government engagement, is a connect and exchange hub so that we exchange the best practice that has really worked. So whether it's the thing I mentioned in Haringey earlier or the work that I know that Roshnara Ali's done with the Bangladeshi community in East London Mosque to get that community engaged. And how do we scale it? So is it a pop-up in Brent Mosque, which I visited? Then we should be able to repeat that in black churches or in community centres and elsewhere. We did a tremendous thing with Hackney, with Diane Abbott, where the Haredi Hasidic Jewish community, where on a Saturday night we went in, it was the people they trusted, the Hatzola first responders from the community. They trusted them, so we empowered them. The NHS gave them the resources to be able to hold that vaccination site on a Saturday evening, and the Hatzola actually did the sort of the communication, the marketing to the community, and we had 364, I think, Haredi Hasidic Jewish members of the community coming forward and getting vaccinated, and some Muslim families also who trust the Hatzola came forward and got vaccinated. So what we're doing is learning from what works, whether it's the Haringey example of teams going and literally helping people book in, or the walk-in clinics, advertising the actual walk-in clinics where you don't need to have your NHS number available to you, can still get that vaccination. We've seen that in parts of London, in Chinatown. A vaccination bus went in, and we I think they got over 500 people who were eligible in phase 1 who hadn't come forward and been vaccinated, came out and actually got the vaccination. So it's that access to the vaccine that's making the real difference. And you're right, it is hard. This is not easy, but I think it's incumbent on all of us to take what works and really scale it between now and the 19th of July so that we protect as many people. And of course, we won't stop there. We'll keep going to make sure that everyone who's had their first dose gets their second dose, and we protect as many people. The great news is that actually, if you look at our place in the world, over 90% of all adults, and I mentioned it in my earlier remarks, in the United Kingdom say they will absolutely have a vaccine, or very likely to have a vaccine, or have already been vaccinated. That is the highest in the world, and we've got to make sure we reach them. Nikki.
Thank you. Can I just start by saying thank you to yourselves at Eastern Eye and Gauravi Gujarat and the wider media family. My grandparents my grandfather has dementia, my grandma is hard of hearing. They both only speak Gujarati, and through the pandemic, when I couldn't spend time with them, actually it was Gauravi Gujarat that they would get, and they would see my picture and be able to read a little bit about the vaccine and the hope that brought. So actually it is down to organisations like your own, Media Voices, who will help us get into homes and communities and remind people that it is not just the first dose, but it's that second dose that is all important. So first of all, thank you for that. And I think it's just to add to what the Minister was saying, we won't stop, we will keep going. The NHS is absolutely committed to delivering on the vaccination programme in every community across this country. That is our job, and that's what we'll keep doing.
Thank you very much for that. Thank you, Dr. Nikki Kanani. Thank you very much, Dr. Ramsey. Thank you, everyone, for coming forward. It's that Dunkirk spirit, the country coming together to get protected so we can get our lives back. Thank you for coming forward. Get that first jab, and of course, get that second jab as soon as you are eligible. Thank you very much indeed.